Hello, I'm Dr. Sadiq Scott. I'm a molecular and cellular biologist, and I'm standing in front of my alma mater, SUNY Downstate Medical Center. I actually have a very long relationship with SUNY Downstate Medical Center because when I was in high school, I was in a program called the Arthur Ashe Health Science Academy, and during that time I learned a lot about medicine, biology, anatomy, the different types of coursework that you need when you're entering med school. But learning all that coursework really made me realize that I wanted to pursue a PhD as opposed to an MD, because I found that the PhDs were the ones who actually developed pharmaceutical drugs, the different things that the MDs were actually administering to their patients. So I wanted to be behind the scenes, really knowing the inner workings. I actually have over 14 years of experience working in research labs, from environmental, entomology, genetics, HIV, and cancer research. I presented at conferences with over 9,000 people and found myself to be the only person of color. To me, this is unacceptable and directly correlated to the health disparities we are witnessing today. It is for this reason that I am starting the Urban Health Science Initiative. The Urban Health Science Initiative is a not-for-profit organization with the mission of reversing the severe health disparities being experienced by people of African descent. To this end, we will be working to establish a laboratory as well as a community outreach initiative.
Oh, yeah.
That's the purpose of having board members. Not so much that I need to have my hand held, because I know I've already run a lab for 2 years.
Yeah.
I know how to do that. We already have community relations going.
Yeah.
So we just now have an organization. We're already doing what we have to do pretty much.
Yeah.
We're already running the organization. It's just that now we have a name. We're going to have it out there and make it available for people to donate.
Oh, I see.
Yeah.
Hi, I'm Dr. Gerald Deas at Downstate Medical Center here. Been here since 1958 as a teacher and as a student also for many of the things I learned here as well. But I'm a supporter of this Urban Health Science Initiative that's coming about for our communities if we are going to prevent disease rather than treat it. Preventing is much more cheaper than when you think about treating a disease. Just one disease such as AIDS is more important that we prevent AIDS by initiating programs that will give information to the young people, not only about their sexual behavior, about their behavior of being a total human being and to have a long life. And so we hope that this will initiate that type of behavior.
Hi, I'm Dr. Aletha Maybank, and I am Assistant Commissioner, New York City Department of Health. I am a pediatrician by training, and I do preventive medicine, public health, with a lens of health equity.
So could you tell me today why you feel that there's a need for the Urban Health Science Initiative?
Well, the basis of all the work and a lot of the work we do, and I look at it a lens of justice and ensuring that our communities not only are healthy and provided healthy access in a very equitable and equal way, but all of the opportunities that create health are also provided in an equal way. And so what I'm very clear about in doing the work that I've done is that we can have programs, we can have education, and it's great, but the reality is a lot of what is put forward as good programs are based on evidence that is created and research that is done. And one thing that's very core when you create research, you create a question. The question is asked. So this is the question that we're going to ask, and we're going to look into this question. But the reality is that there aren't enough of us of color who are asking those questions. So many times we're not asking the questions that are actually relevant to get to the right issue or to address the issue properly. And so the more focus that we can have on filling that gap, the better it is overall for helping to address health equity and health inequities that exist.
Absolutely, I completely agree. Thank you, Aletha.
You're welcome.
My name is Susan L. Taylor, and I'm the founder and CEO of the National Cares Mentoring Movement and Editor-in-Chief Emerita of Essence Magazine. And it's my honor to serve with our leader here, Dr. Scott, as a partner and a supporter of the Urban Health Science Initiative. It is critical to African Americans that we learn more about nutrition and the science of eating and how to eat natural, whole foods. So much of what we eat is manufactured, and a lot of those manufactured things, foods that are made in factories, are causing incredible illnesses.
Absolutely.
So we're dying early, we're sick, and disproportionately so when we look at other communities in the United States, and a lot of that has to do with our lifestyle, with poor choices in nutrition, poor choices in what we put in our body, and certainly it has a lot to do with stress. And so it's my honor to know you, to say that you are really an advocate for good health, in all communities, and I'm happy that all that education you have, all that knowledge has been brought back to the African American community. We really need you so desperately. So it's my honor to work with you and to support you and to see how we can grow this initiative and really just move the needle in the right direction so that we can bring more African Americans to health, wellness, and longevity.
Absolutely. Thank you so much, Susan.
Oh, it's my joy.